Okay, guys, we're gonna go ahead and get started just for time purposes, because I know everybody's got stuff to do. We're gonna call the meeting to order at what time you got?
12:07.
12:07. Okay, let's go ahead and get started with our.
So your agenda is going to be on the first page of the binder, or you don't have it?
Yeah, I don't have it, but I have my agenda right here.
There you go.
I'm gonna go ahead and let's get started with roll call really quickly. Mr. De Anda, Javier.
Here.
Okay. Ms. Bruni has resigned from the group and will try to see if we can find a replacement in the meantime. We do have, well, let me do roll call first. Pancho, Averill. Pancho.
Absent.
Is he coming?
He won't be.
Good thing he's not here. Right?
After all the
I know, a lot of back and forth. Pancho
Pancho
Averill.
Averill.
Alfonso Averill. Guadalupe Ramirez.
Here.
Okay. Jorge Gonzalez. Hector Alanis. David Cash Vasquez, present, and Dr. Richard A. Chamberlain, liaison, is present. Great.
We do meet quorum.
We do meet quorum. Great. Moving on, the public comments.
We do not have any public
Do we
comments.
No public comments, great. And then, of course, an approval for me, I'm gonna move on to our next item, approval of minutes from the November 7th, 2024 Health and Wellness Subcommittee meeting.
I move to approve the minutes.
Okay, Lupita, move. Second. Javier. All in favor?
Aye.
Motion carries, great. Minutes approved. And, sorry, just taking a few notes for myself. Okay. Moving on to the presentation by the Public Health Department Director on the Pediatric Hospital Proposal, Public Health Department Enhancements and Improvements Proposal, and any other actions incident thereto.
Thank you, Mr. Chairman, and it's great to see everybody here again today as we work towards providing context for the overall bond referendum committee at the next meeting, which is scheduled for the second week of December. I wanted just to start off by saying that the pediatric hospital discussion that we will have right now was recommended and brought upon by our mayor, and he wanted us to explore the issue. And so there is a presentation that has been put together. It's about 10 slides. If you'd like a copy of this, I'm going to also, as mentioned just a few short moments ago, there are a plethora of different assessments that are before you from years past and most recent. These will also be shared with you all to provide you some good bedtime reading for the evening, since it's probably a little heavy on data and not everybody really likes data right before bed, but it'll definitely be something for you to dream about as we are being visionary in this moment right now and discussing legacy for the city of Laredo public health and healthcare. So with that, I wanted just to give you some geographic disparities in access. So 75% of Texas children live more than 60 minutes from a pediatric hospital. Laredo is significantly underserved, and families often travel to San Antonio beyond for care. Critical and emergency situations, these delays can result in poorer health outcomes for children. The shortages of pediatric providers, there is a severe shortage of pediatric specialists in Laredo, reflecting a broader statewide and national trend. The Laredo Healthcare Services Assessment outlines Laredo ranks amongst the lowest in Texas for access to pediatric services, forcing many patients to seek care outside of the region. So we do have that severe shortage of pediatric specialists, especially in ICU and inpatient care. We do have long wait times, resulting to referrals to out-of-region providers. And by 2032, the Texas Department of State Health Services Region 11, which includes Laredo and South Texas, is expected to face a 46% shortage of pediatric specialists. So this is not unique to Laredo, but it is something that we are experiencing here in our geographic region. Regarding health disparities, children in Laredo face compounded barriers to care due to socioeconomic factors, including high levels of uninsured families and undocumented residents who are hesitant to seek care due to border enforcement. Around 20.1% of Laredo's population lives below the poverty line, significantly higher than the national average of 12.6%. Approximately 10.6% of children in Webb County are uninsured compared to 9.7% statewide. Lack of reliable transportation further isolates families from healthcare services. Public health crises like the triple-demic of RSV, flu, and COVID highlighted the critical shortages of pediatric hospital bed availability, leading to delays in cares throughout the pandemic. And educational attainment and limited health literacy contribute to the increased emergency room visits. So evidence and supporting data for a potential pediatric hospital is 27% of Laredo's population are children, but no pediatric hospital within a 150-minute radius. Pediatric patients make up 25% of ER visits, mostly treated in adult ERs, and only 10% of Texas hospitals have pediatric ICU beds. So these are some potential solutions, and I wanted to start off by saying I know there was a comment made about a potential public-private partnership. I mentioned in the last meeting the bond referendum funds could not entertain that. I wanted to make sure that that was put in writing by our legal counsel for the bond referendum. I wrote that email this morning at 7:30 hoping for a response, but I know he's very busy. I'm pretty sure the response is not going to favor that public-private partnership, since the public has no say in any private business or organization as to how those funds would be further utilized in a brick and mortar or equipment setting. So I'm leaning more towards we could not do that. But within a collaborative public-private partnership is to engage with systems like Texas Children's Hospital to create satellite clinics or hospitals. There could be a phased development with the start of a specialized wing in an existing facility before a full hospital is rolled out. There is the ability of telemedicine expansion, and then ultimately the workforce development with implementation of loan repayment, relocation incentives, throwing out all the bells and whistles that I know have been in existence for quite some time. As our health authority, Dr. Carsagongora, has mentioned, we have pushed every button to make as many persons come into the community, but we can always work harder and do more to make that happen. So, how much would this cost, right? That's the big ticket question. So a pediatric hospital may require an estimated $500 million, a 150 bed facility, to $2.5 million, a 300 bed facility, in initial capital, and operational expenses at a 150 bed pediatric hospital is an estimated $134 million annually. Let that sink in for a second. And so that wraps up the discussion about the pediatric hospital discussion on our part to present information to you all. And so I'll turn it back over to the committee for discussion amongst yourselves. And ultimately, as we are very much aware, there's $700 million in the overall bond. So take into account what was just shared here, and you all discuss your recommendation for further pushing this towards the committee at the macro level.
Can I ask you a question? Yeah. On that slide about pediatrics, I mean, your school they still come down here and do some of those services.
Correct.
So I know you still have to take your kids to the hospital in Corpus, it's an inconvenience or whatever, but they had pediatric cardiology, they had some other doctors that were coming down, flying down daily or during the week.
Correct.
Does it take that into account? You know, as far as the numbers?
I'm not too sure of that data, the data.
I'm sure we're still underserved.
That's a given. The underserved is a given.
Sure.
I do know that I was approached by the Texas Health Institute, who did help us prepare a community health needs assessment letting me know that Driscoll is going to run a health needs assessment for this area as well, and that they would like Laredo Public Health to contribute to that as Driscoll pushes that forward, as they are obviously entertaining the idea. It's going to happen, but it's something that we know that is looming in the near future.
I would see that happen.
Driscoll does fly people in.
They fly their doctors.
They fly the doctors in.
In and out, yeah.
In and out, because I've seen the plane.
Yeah, no, we used to take my daughter to a doctor here, who came down and
If I'm not mistaken, excuse me, if I'm not mistaken, I think Driscoll Children's Hospital has a partnership with the Red Medical Center. Only, correct? Not both hospitals?
No, they have with both, and they
With
receive
both?
people from the community.
Got it, okay.
And if you might,
Go ahead.
interject, as a person who worked the hospital before,
This is Dr. Seva,
Yes.
Community, I'm sorry, Clinical Services Administrator.
both hospitals used to have a designated for pediatrics, but the numbers were not there. They closed the doctor's pediatric program, and it goes the same for NRC. They have small units because the market is just not there. I know there's cases where we need specialists, but one of the main reasons we don't have more specialists is because there's not enough cases for them to keep them busy. If you bring one specialist as a traumatologist, as example, you're gonna have one case per week, two cases per week. That would make a living for them. Not only a living, he will be,
operationally.
yes, operationally, he's not gonna be happy here.
No.
So that's the main reason. I know this is something the community and the public perception wants to have a pediatric hospital. In reality, it's a very difficult market situation, more than anything. Vaccines work, and many other preventive services work. That's why we don't have as many hospitalizations as we used to have in the past. So it's just two cents.
So, I'll chime in, guys, cause I did a little research on the pediatric hospital. As you know, my CEO spent 25 years in hospital care, and hospital settings. Ran Doctors Hospital, from the ground up, ran Laredo Specialty Hospital, so he's a little familiar with the construction side of things. When we're talking about the size of pediatric hospital, it's all gonna depend on the size of beds. So, or the amount of beds. So currently at the moment, right now, if you wanna open a hospital, it's about $2 million per bed, right? So you start doing the numbers, you start talking about, the doc's presentation pretty much adds up, right? From 150 beds, you're looking at 2 million, 2 million per bed, and that doesn't even include the land, right? This is just the bed, the construction, the equipment that goes inside of each bed. Now, when you start talking about pediatric hospitals, and this is just something that we've been seeing and that I've been seeing in the healthcare industry, we're talking about a specialty right now. We're not just talking about some nurse that comes in and deals, you're talking about pediatric nurses. You're talking about pediatric, pediatricians, specialty, pediatric anesthesiologist, right? Right? This is a person that's gotta know the dosage for kids, for a preemie.
And the license.
And the licensing and the certification and all of that. So these are like diamonds in the rough, right, if you will, within the world of medicine. My concern is that one, the reason that Driscoll or Texas Health or Baylor Scott and White or all the UHS, CHS, the reason they haven't done it is because there's not a market.
Exactly.
There's not a market for.
Otherwise, they would have already done it.
They would have already done it.
Laredo's too small, we're nowhere, we don't have insurance.
And I just tell everybody to go back to the data, right? I know it's lunchtime and we said like no data, but let's look at the data right here. 1/3 of Laredoans don't have insurance. I mean, that tells you everything. They don't have insurance. Who's gonna pay for this? Who is gonna, and not only that, how are we can build it through the bond. We can buy all the equipment through the bond, but we can't pay for operations, right? So how am I gonna operate a $13 million a year budget? Where is that money gonna come from?
I will tell you that on the uninsured, I sell health insurance, so Molina Healthcare has some great plans and there's subsidies and stuff from the federal government, these Obamacare plans. So we need to do a better job of getting that message out, because there is a way to get a lot of these kids insured
Yeah,
that
but
people don't know about.
when you start, okay, so then you start getting into payer or reimbursements, that's another challenge.
I know.
Medicaid reimbursements rates for hospitals, for primary care, it's wonderful. We're great on the primary healthcare side.
Not for hospitals, no.
Hospitals,
The reimbursement rates are.
the reimbursement rate is like 72% right now from Medicaid. So if you got a $500 a day stay in the hospital, Medicaid's only paying 72% of that. So you're losing money.
And then you have those laws that if children comes to the emergency room and they don't have insurance,
You gotta pay.
you have to. And those are millionaire losses for hospitals.
I think the goal, or the 150 bed goal is lofty, for this area. That's just, I think a pediatric hospital, period, is lofty for Laredo. Just because the market, I don't think the market is there, just by looking at the numbers. But if you wanted to start small, start with a 25 bed. Now we're in the range of 50 million with an annual budget of $10 million for salaries, but that's, or not salaries, but 10 million, with a $10 million operating budget. That's a little bit more attainable, I think, but that's gonna be a challenge within itself, because if you have the city, and no disrespect to the city, but if you have a city-run pediatric hospital that doesn't even have specialists, how are you gonna do it? So that's the biggest challenge. Without the public-private partnership, that's gonna be the challenge for this particular
The
endeavor.
city doesn't have the operational capital also to
Exactly.
fund
Right,
that
so-
on
And that's-
an annual basis from the
We
taxpayers to
don't
pay
wanna,
for it.
we don't wanna build something and then in a couple of years see it in ruins. So,
I
we don't
think,
wanna throw our money away there.
I think the I think we should maybe just have a consensus, or maybe just ask the question here. If we all think, because I mean, it's one thing, you know, what we as a community want, but we have to be realistic. So I think we can talk about this for 3 hours.
Yeah.
We're just be spinning wheels, but I think, you know, having the information that's been provided by Dr. Timberland and Dr.
Seva.
I don't think our community is at a point where we can sustain this type of operations. And I think we need to make that decision now, because I mean, we can talk about, you know, what we want and how we can make it work, and then we can, you know, come up with something and then push it over to city council, and city council, I'm sure, has already done a lot of studies, has a lot of information of whether or not having a pediatric, you know, hospital, whether it's 25 beds or 150 beds, whether or not it's not gonna work. So, but, you know, maybe we can poll everyone in here and talk about that topic, and then look at options. So if we can't get that, what can we do?
Well, the
Right?
question-
What options are there?
One of the questions I have with the bond is, let's say we do get the money to build the pediatric hospital. At what point can the outside world come in and offer assistance? Could the city build it and then say, go to a Driscoll, for example, and say, we'll build it, you operate it, you operate it, you staff it? I mean, is that even possible through this referendum?
I'm waiting on a response from our legal counsel, Mr. Juarez.
But it would be the same thing, do we have enough cases for Driscoll to say, yes, we'll go ahead and run it?
And the other outlier is, can we even staff it? Since our current hospital systems don't have all their beds staffed to this date.
Exactly. Because now we'd be playing the role of a landlord.
Right.
if we did the bond and use that money and we build it, don't we have to go back to the taxpayers and start having them pay taxes on that?
It's paid over 30 years ago.
Yeah.
Yeah.
So now we gotta go back to the
It's
public and say, we're gonna build this hospital, now we're gonna tax you more.
Well, yeah, I
Well,
think
that's
that's
the
where
point
they,
of, that's the bond, that's
I,
how the bond gets.
I know, but,
Yeah.
and that's one of the challenges of building any hospital, especially, we've been talking about having a county hospital forever, but like we do in San Antonio. And that has never happened because you gotta go back to the taxpayers and they don't wanna pay taxes for it.
I think that tax would have to be adjusted so that we can bring the money in.
So
And so that turns up another issue at the Texas Administrative Code level, because we're capped at 3.5% for our property, we're capped at the sales tax at 8.25, and we are maxed out on both sides already as of this moment. So that would take the act of the legislator to make that change, and then of course the governor to approve it.
But, once again,
And
I'm
will
gonna
the
bring up the
Republican
point,
control
I'm gonna bring up the point
Texas?
that both hospitals have pediatric units and they no longer have pediatric units because number wise, we don't have, the number of cases to sustain that operation. So I know everybody wants to have a pediatric hospital in Laredo so that people don't have to drive 2 hours away, but we just cannot sustain that. So we have to be realistic. Now, if we were to grow, within the next 20 years and double our size, I can pretty much guarantee you that at that point, there will be a need for a pediatric hospital. Corpus Christi is a little bit different. I think they have one or two. Is it just a one? Driscoll. But you have to remember the history of Corpus Christi and how they ended up with a pediatric hospital. We're not Corpus Christi. Rio Grande Valley is now a metroplex. They have 800,000 population between the valley, I think. So they can
1.2
sustain
million.
1.2 million. So they can sustain that, and we're just not there. We're not there.
If it were something that both hospitals would have already jumped on it, Driscoll would have
Yes.
already jumped on it. And the reason they're not doing it is because the numbers aren't there, and they're gonna lose money,
Right.
realistically. We do have options, glad that Driscoll comes here and people can still go, but,
I think on a project like this, it's gotta be public-private.
yeah.
That's the only, on this particular project, because the bond doesn't lend itself to, operational cost.
Yeah.
I mean, that's just, however, if legal says it is a reality, it's possible, then you got a shot there. If public-private is possible through this effort, there's a shot there, because then you gotta start looking strategically at where we would place the hospital, right? Where would you place it? Who has the land? Would it be in the public's best interest to place it in that area? And then the owner of said land to create, or donate the land, create an endowment, things like that. Those are like all little different things that can be done to finance a project of this magnitude, to get things rolling, especially with the city on board, if that is
If we
possible,
were
but
to-
we are waiting on legal, correct?
If we were to, like, there's the possibility we cannot build because we cannot sustain it, can part of these bonds be to buy more, I don't know how we transport them, helicopters, to have them more available in case we need to transport someone?
That's operational, no?
Well,
That would require an operational individual.
I'm waiting for finance to jump in
See,
here.
Well, but then again, you're not competing with the private sector. It's not what you really want to do.
You're not, what, competing with what?
The
Competing with
private-
the private sector.
Because really, from entrepreneur's perspective, is again, if it was feasible, they would have
Would've
It's already been done.
And certainly, if there's opportunity, the private sector will jump in.
So
Do we have
I go back
enough,
to your,
transportation quickly, if someone needs a transportation, we never have difficulty and say, well, we can't find the helicopter to fly them out, is that readily available when it's
If I'm not
needed?
mistaken, I don't think that's been an issue.
No.
And if it's an issue, we can talk about that, during, when we discuss options. What I had in mind is a couple of things. When we talk about options, and maybe Dr. Selva and Dr. Chamberlain can give us some information on this. Currently, what we have in place Is it working? Do we need more help? And if we do need more help, is there another hospital, like Texas Children's Hospital out of San Antonio, Santa Rosa Children's Hospital, that can provide the same type of program that, Driscoll, Children's Hospital is providing us? I mean, that would be an option. And then the other thing I would wanna talk about, and we can kinda segue into that, is talk about what has really brought this discussion into the community, and, it's almost kinda like a hot topic, and now is when the, Clear Choice Hospital, when they acquired the land from the Killam, they said, hey, well, we're gonna have a pediatric hospital, and we're gonna be working with the city of Laredo. I don't know where that came from, because the information that I've gotten is I don't think there was any commitment. I don't think the city of Laredo could make that commitment, but it was stated on air and it was reported. And so a lot of people are thinking, oh yeah, we got a pediatric hospital coming in. I don't think that's the case.
I do wanna say, the misconception is that we're not taking care of pediatric kids. We're taking care of pediatric kids at both LMC and doctors.
Right.
And if they have to fly them out, they fly them out, and we get them
Right.
quick. So it's not that they're not, we don't have a specialty pediatrics hospital with special nurses and whatever,
Right.
okay? So, we are seeing kids, we are taking care of kids and whatever. It would be great to have that hospital, but you see what the numbers are.
Yeah. No, I think I think both hospitals, or all three hospitals are all doing the best they can with
With
what
what they have.
they've got. I mean, I know, doctor's team is working hard to recruit. LMC is doing all they can to recruit. We're doing all we can to recruit. The challenges, I mean, are beyond, sometimes are beyond even money. It's not even a money thing, it's more quality of life and all these other things that we can talk about for 3 hours, right? But it's, the big picture here is that staffing would be secondary. It would be the initial part, right? The initial part is, and this is just from looking at the optics, right? Is can we build this in conjunction with a private entity? And the reason you need the private entity is because we're gonna need to staff. The private entity is the key to staffing, and not just any private entity. It would need to be your Driscolls, your Christus, your Methodists. Like these guys are the big time in pediatric oncology, pediatric surgeries. Like these are the folks that we would need to bring to the table and say, hey, look, we got this thing, we've got it on the table, would you be interested in partnering with us? We build it, you man it.
I think that's the only way you can do it, and Methodist helps down here too, so there are opportunities if you can do that partnership. To do a bond, to do this, whatever, even 25 beds, I think it's super challenging.
Yeah. I mean, well, if you do the math, at 25 beds, we're right in that range of the 60 million that was initially, I guess, proposed, right? So you've got the 60 million there for the pediatric hospital, right? It's the operational budget that private partner would need to take on.
It's just a building. A hospital is just a building. What makes a hospital are the doctors, the nurses, the staff.
Right.
That's what makes a hospital.
It's the
Not that-
operational
it's just a
piece.
building.
Mm-hmm. Because we could, just like we truck out, look, there's someone that's doing a study on how much I think you may have been in that meeting, right? Where Dr. Vitron from Clear Choice is doing a study, and according to his initial numbers, we're pumping out $100 million in medical bills
Or
to
revenue.
the outside. Actually, were you
Yes,
there?
yes.
Dr. said that? Yeah, you were there.
Yes.
Where he was saying we're pumping out $100 million just from Little Laredo, $100 million
For claims outside already.
claims outside. So I don't know what percentage that is of pediatrics,
Yeah.
right? Because that's a whole
Increase,
nother ball game. But there's a chunk there that could possibly sustain this hospital if we get that second piece. But I think we need
just have to wait.
the answer.
So that is homework for us to bring back during the subsequent meeting, during the open discussion as well, to give you all a little bit more clarity and perspective.
I'd like to table the item then, if that's okay with everybody. I'll make a motion to table the item for next meeting.
A second.
To table the discussion of the pediatric, cause the item still has the public health portion.
Yes, well, what is the public health portion, do we know?
We're gonna get into that one
Oh,
right
we're
now.
gonna jump into that, so the pediatric hospital discussion, table it for the next, meeting pending,
Response from
response
council.
from legal, so, that's my motion.
Second.
Second by Jorge, all in favor? Okay, motion carries.
Under discussion, you know, I'd like to also maybe ask, perhaps we can speak to Jorge Liat, CEO over at Royal Medical Center, and to Andrew over at Doctors Hospital, so they can give us some information regarding their current status and their
I can invite
thoughts,
them.
and their
I think we
thoughts
should.
on pediatrics.
I can invite them, we'll do that.
Okay. So,
So,
okay, so let's continue with the, public health proposal, or,
so I know we were just in a niche right now of thinking about emergency care for pediatrics, right? That is a reactive phase in our public health healthcare system. So I'm gonna take you all back from that very narrow scope of view to come back to the macro level and think about the public as a whole and what we could do to be proactive in our approach to public health and healthcare in our community with public health at the forefront and building a legacy project out of Laredo Public Health. So, just to give you some perspective here, let me go ahead and pull this up and talk to you about the Laredo Public Health of tomorrow. So to start off, we all know that there are many public health challenges, and Laredo faces a range of pressing public health challenges, which underscores the urgent need for robust infrastructure investment, particularly in public health facilities, specialized equipment, and expanded physical spaces for healthcare delivery. We know that we have a high chronic disease burden, diabetes, hypertension, obesity, Alzheimer's and dementia, mental health care and behavioral health needs. Access to mental health care is severely restricted. Substance use and addiction treatment gaps. Yes, we just opened our detoxification facility. It is a small 24-bed facility. It has been busy since it's opened, and it's not enough, and we're still missing the rehabilitation part. We have our health professional shortage and medically underserved area designations, which is focused on, we need to focus on that recruitment and retention, which we have issues with within family and all specialty medicine. We have our high under and uninsured population, and of course the social determinants of health with our poverty, our rate, our food insecurity, and housing and transportation limitations. And so to give you some more perspective, right, on concentrating on the macro level. So aging is a progressive biological process that influences health across all stages of life, beginning at birth. While average lifespans have increased over the past century, health spans, the period of life spent in good health, have not kept pace. Today we are faced at an imbalance. Reductions in mortality outpace the improvements in preventing morbidity. Few countries allocate resources specifically for addressing the underlying factors of aging, which lead to many age-related conditions such as arthritis, diabetes, cardiovascular disease, Alzheimer's, and dementia, and that's just to name a few. To address aging comprehensively, we must focus on root cause and integrate the principles of lifestyle medicine into daily life. Education on a basic preventive practices should start from an early age, converting not only hygiene but also the 6 pillars of lifestyle medicine: healthy eating, regular physical activity, restorative sleep, stress management, and social connections with avoidance of harmful substances. These foundational practices should become as routine as brushing our teeth, embedding health-sustaining behaviors into the fabric of our lives. So investing into local public health infrastructure in Laredo can create a proactive environment that supports these lifestyle changes by strengthening resources, education, and preventative services. Laredo can help residents build resilience against aging, which begins from the day we are born. Sorry, where was I?
Such
investment. Such
Such investments in the third paragraph, third line.
Third line, such investments promotes a shift from reactive to proactive health management, supporting people of all ages to lead healthier lives and reducing the burden of age-related diseases. Aging can be positively influenced throughout our lifetimes, and a lifestyle medicine approach is key to empowering individuals and communities to maintain vitality as we grow older. So, the proposal from us at Laredo Public Health is requesting the $60 million in bond funding to expand and modernize the infrastructure originally built in 1970. So I have some very interesting documents here, which this goes back, and this was published in 1968. So this document that was published in 1968 talks about the flood in 1954 that occurred and the havoc of infection that was already prevalent here in the community, and what it did and what needed to be done, and ultimately how the US federal government stepped in and brought the attention to Laredo. But what was very interesting here is that it was forecasted in this document the building of our current facility. Let me go ahead and find that really quickly so I can show that to you all. And so our facility was, of course, just a thought when this was published in 1968, but the rendering was already there with the old Mercy Hospital as well. Very telling to have this here, and I'm sorry I can't find it in the moment, but it is here. If you would like, Mr. Chairman, to flip through that. And so, as we're discussing our history, and we were very blessed to have our health department downtown in a very small building, as Laredo Public Health was initiated as Laredo Webb County Health in 1935. So we're coming to the century mark, and there has been so many advances through public health that has helped elevate the community from the many public health challenges that were faced in the past, which includes the many infants not even living in our community past the age of 1 in the 50s. So that is eye-opening to read that in that document, and then ultimately the infectious diseases that were combated, like tuberculosis, as I was reading, that it was about 68 cases for every 100,000, and that was in the 50s. So that was very high. So thank you so much. So here you do have the Laredo Public Health Department rendering, and of course the old Mercy Hospital, as these were investments into the public health overall infrastructure back in the 60s. This building, as you can see here, opened in 1970. We definitely
The old Gateway building is in there too.
This is a beautiful document, so I'm gonna find a way to digitize this and share this and post it on our website as well, because this document was a treasure for me to find here in our archives.
On Arkansas.
So with that, we are asking for that $60 million so that we can expand this department, which on WebCAD sits at 79,000 square feet to 145,000 square feet, building up and adding an additional building on this property. So we'll share a little bit more as we go into it. So a little bit of background. Laredo Public Health Department is requesting $60 million in bond referendum to expand and modernize its infrastructure, originally built in 1970, and currently is insufficient to meet Laredo Public Health's needs. The investment will allow us to expand to, sorry, that's an error, to 145,000 square feet, allowing, does not say that. It's 145,000 square feet, allowing better accessibility and program support. A structural assessment of the Laredo Public Health Department is funded for this current year, a $300,000 investment, which was identified in the budget process has already commenced, and we do have Miss Erica back here, our assistant director, that is focused on the assessment that is gonna tell us from the renderings, the drawings that were produced from the architect in 1960, there is a third floor that was never built, that the building could sustain it. So this building does sit on giant pylons, so that way it could be built up. So we are conducting that structural assessment already, because we had this in our vision, and the bond referendum came around and is allowing us to accelerate that with your support if approved. So, and to give you more perspective, since January of 2024, through our current executive leadership team, as you see here in this room, Laredo Public Health was actively involved in grant acquisitions, but we weren't very aggressive about it. And we turned that on after COVID, and this year we applied to 18 different awards totaling more than $48 million, have secured 7, that totals to $10 million, and we do have 2 pending, that if awarded those 2, that'll get us over the $30 million mark, as one of those is a $20 million opportunity for the city of Laredo. So why am I saying that? Because every time we are bringing in a new program, whether it's focused on Alzheimer's or on helping daddies be good daddies, or in our chronic disease management or diabetes prevention, there's nowhere to put these individuals and programs. So as we're listening to what the community wants and truly understanding what is needed, we're turning on those switches, just like we did with our neurodivergent population. We brought in $10 million for autism and neurodivergent population surveillance and support. We placed them here, but we're sitting on top of each other in this building right now, and it is very difficult to continue to have that vision and listen to what the community needs if we're going to have to be wasting award monies on rent, which is therefore not being stewards of those funds when we are getting the money into Laredo for the specific programs that are needed by the community, or we're just enhancing what exists. So with a remodel or relocation, because there could be a possibility of a relocation, we are accommodating program growth. This building also is not ADA compliant, and when you think public health, you think of inclusiveness. We want persons who are bound by a wheelchair to have easy access and ease cruising through our system.
Can it be made ADA compliant?
It can be brought up to code, yes, sir.
We've slowly been working
Go
on
ahead,
those
Erica.
processes. Good afternoon, Erika Martinez, Assistant Director. We've done some improvements. It takes a lot of retrofitting. Of course, sometimes funding is an issue. Dr. Chamberlain did mention our grant growth. However, grant funding usually does not support brick and mortar. We cannot use that towards construction or improvements. So slowly we've been doing, I mean, you guys see the example of our push button doors right here in administration that take a little bit to open, but that was a solution that we had based on the age of the department and what could be put in place to accommodate for that accessibility.
Safety in the department, as you can see, we do not have a fire suppression system, and we have hundreds of persons coming through this building on a daily basis that would greatly benefit by making sure we are up to code. Also, the labyrinth of the department makes it a little bit difficult to navigate between programs due to it being pieced. There is a downstairs, there is an upstairs that flows into random hallways, and we would of course do an overhaul to ensure that the flow is more efficient for persons visiting the community. And then ultimately, it's a stronger bottom line. When we invest into public health, we invest into the community. The specific project objectives, just to break it down a little bit more, would be almost doubling the facility size from 79,000 to 145,000 square feet. Will allow us to expand program offerings, accommodate population growth, and provide necessary space for future initiatives. We will ensure ADA and fire compliance, modernizing the building to meet ADA and fire code standards. Will ensure all residents, including those with disabilities, can access services safely and without barriers. We will expand health services. Expanding health services will increase our capacity in primary care, mental health, and disease prevention, meeting the growing demand for comprehensive public health services in Laredo. We will establish community and research spaces and new spaces, including a community auditorium, classrooms, and research areas. Will foster health education, public events, and collaborative opportunities, strengthening the community engagement and outreach. So ultimately creating a legacy for health and wellness. So there is the option. Option one is to expand and renovate our current facility to 145,000 square feet. And option two is to relocate to a larger facility for building, remodeling, and acquisition of the land. I wanted to show you the bird's eye view of the public health department campus and footprint. I'm gonna take you out to Google Maps, so that way you're able to see the public health department. I can also share with you that thanks to our partners at Community Development, there was a vacant building right here on this corner, which was a Head Start. So all this property right here belongs to the city of Laredo and would be moved into our plan, so we can expand and put an additional building on that campus that will support the health department as a whole, while building up on the health department that you see here on the screen.
There's a vacant property right next to, or it looks like an open property next to, where is it, on the Cedar. Does that belong to you all as well?
Yes, so this right here, it belongs to us. We recently had discussions with Webb County so that they can remove their modular building that was there, and they removed it for us as we have addressed that as an expansion site for Laredo Public Health.
Okay, and the one at the corner of Price and the green building, is that
This
the
right
city?
here,
That's a park.
this is a park. This is a park right here, and this belongs to the city of Laredo.
Okay, is it utilized a lot?
Yes,
Yeah,
it is.
there's people there.
So previously, we used to have a playscape within our location. That was removed, but with the assistance and collaboration of Parks and Rec, now we do have that.
The playscape was located right here in the courtyard when you walk in from the Cedar side.
So in total, what's the square footage that you
So we're looking at this building up on the whole building, and so that would increase our capacity by 40,000 square feet, and then building another 15,000 square foot building in this area for the expansion of services as well.
which would get you to the 130?
Mm-hmm.
Would we still
145,
have
sorry.
enough
So
parking
145.
spaces for?
And so that's
since
another
we're
thing,
gonna double the service?
we can extend parking right here as well to add
Okay.
additional parking spaces for this
Yeah.
project as well.
Yeah. Parking is always
And
an
to
issue.
put a face for the health department users, we have close to 30,000 encounters per year. 30,000 individuals come to this old building to receive services. We have to think also about in regardless of if you're conservative or liberal, usually during conservative governments, they decrease funding for public health. Yet the patients are gonna be here anyways. And we have seen that decrease in funding whenever there's conservative governments. That may work for areas with a higher insurance percentage. Here, 33%, it doesn't work. For Laredo, it doesn't work.
Did you say 30,000 encounters a month?
A year.
A year?
Yes, and those are families, and those, we don't ask if they have documents or not. We're just mandated to offer services, because those guys are part of our community, they're still here. And it's very important to see that we might see a decrease on funding. For the last 50 years, the city hasn't given us anything for brick and mortar, but they give millions for an animal shelter and millions for detox.
Yeah.
So there are priorities, right?
What's the percentage of the budget that public health receives currently at the moment?
In the last year, it was 2.3% of the overall budget for City of Laredo General Fund. So this is why we want to invest into the infrastructure so we can continue to grow in the future, with of course the support of the general fund, but seeking the state, the federal, and the private opportunities to expand.
What's the goal, or what's your target goal once you get the 145 of?
I'm gonna keep on going, and
Oh.
we're gonna share more for you, sir.
I'm jumping ahead, Doc, sorry about
No,
that.
not to worry, Mr. Chairman. So the projected cost in the timeline has mentioned $60 million, the cost, and I'm gonna break that down because we were working on a veterinary clinic for the expansion of our operation at Animal Care Services. And in 2021, when the bond was issued and when they were working on it, right, it was $240 a square foot to build. We're pushing play next year to get it done. Now it's $540 a square foot to be built. Our fire department expansion that is going to be built on North McPherson, north of the Olive Garden, that is $720 a square foot to be built. So in our public health realm, we're looking at $900 to $1,000 a square foot to be built. So at an extra jumping from 79,000, 80,000 to 145,000, that puts us at about 58 million and change to make the expansion up and to build the additional building on the Cedar side of the property. The timeline would be a projected 3 to 4 years to complete from its inception. So the impact on the community health, right? We're gonna expand accessibility and inclusivity. The upgraded facility will be ADA compliant, ensuring that all community members, including individuals with disabilities, have equal access to high quality public health services. We're supporting population growth. With the double the space, will meet increasing demand for health services, accommodating the rate of growing population and expanding access to comprehensive community-centered care. We'll build community resilience with community spaces for events, health workshops, and collaborations. We'll strengthen social ties and preparedness, fostering a resilient, health-conscious community equipped for the future challenges, and fostering preventative health culture. New programs focus on lifestyle medicine and health education will empower residents to make healthier choices, reducing the long-term burden of chronic disease across generations. So, with the expansion of space, that triggers a whole bunch of different opportunities for us. And the general fund has been investing into public health the last 3 cycles, so we're very fortunate and we're blessed that we have the ear of the council right now as they are injecting more money into public health, and we hope to continue to ride that wave as we move forward into the future. But nonetheless, as you heard at the beginning of the presentation, we applied for 18 awards this year, and we basically have a 1 for 2 that we're getting awarded. So
You have what, one?
for every 2, we're getting awarded 1. We're at 42% accomplished rate. So that is great in our realm for bringing in those dollars, and that's something, thanks to this team that we have here, we're going to continue doing. So we're going to be looking at primary care, primary and preventative care expansion services. We just got the Alzheimer's grant award. We want to continue to scale up on that. For Alzheimer's, dementia, and aging support, disability and neurodevelopmental care, caregiver support, pediatric health. We have a little grant that we just got for pediatric health that Dr. Sadla is working on, so that way we can turn on the pediatric element, and we look up to our big brother, big sister organization at Gateway, but we know that they also can't do it alone, so turning on additional little pockets is just to benefit the community. Focus on that lifestyle medicine approach, which starts at the day you're born, basically. We need to make sure that we are getting into root cause. Everybody always talks about working upstream. We are not working upstream anymore. We need to be working where the groundwater comes out. So we're making the difference for the children, which are our future generation, and it's never too late for any one of us to jump in as well and start focusing on lifestyle modifications. And then, of course, our clinical laboratory expansion. I don't know if you all are aware, but we do have a clinical laboratory here. We have an environmental laboratory. We have a BSL-2 and a BSL-3. So those components require, of course, upgrades as well, and the amount of persons that circulate through our laboratory, because we do have chemistry panels that are 40 $50 and $60 if I'm not mistaken, that don't require any prescription, and anybody can come in and get their their chemistry provided to them and then connected to services based on those outcomes. Yes, ma'am.
So if we were to double the space from 70 to 145 square feet, we would have no problems in the operational expense? Do we have that already for doubling the amount of space?
So operational expense just allows us to actually breathe right now, because right now we are sitting on top of each other in this
Right,
building. So
okay.
expanding allows us to actually have spaces that are not shared with other programs and have those programs be able to develop themselves out and have their flow come in. So we also want to be very respectful to somebody, say for instance, that's coming into our Let's program, which is specific for HIV, STI, STD. We don't want them bottling up with our vital statistics office, which has tons of people coming through for their birth and death certificates, and that is right on the corner of each other. So that's not really conducive to patient confidentiality. When you see somebody at the Let's program, you know what it is, they're walking into a door, but they're sitting in an environment and waiting for their birth certificate. They're kind of putting 1 and 2 together. So we want to make sure that we really focus in on those little elements, that, because I know that I've sat there and I'm like, this is tough, but this is what we have. And we're gonna make it work in this moment with what we have, but if we can focus on that legacy as we're asking for here, you all can definitely make a difference.
So on that note, well, let's run really quickly. Is that the end of the presentation?
There's still 15 more slides.
Going back to Lupita's question, are there gonna be any additional?
And my colleagues know me very well, and that they're laughing on that side, because that's classic me, I apologize.
Will there be additional needs for staffing or
That
maintenance?
can be supported through grants.
Through- I
So,
mean,
Now we do it by,
focused on your question,
Yeah.
going back to your question, is that would, give us the opportunity to pursue, and we are confident in our ability to secure
Mhm.
additional program,
What's
that
our track record
operational
is showing.
support through
Okay.
grant funding.
That was
Very
my
good.
There are,
Thank you.
But City of Laredo
contingencies, but
City of Laredo gifted us, thank you City of Laredo, last cycle, 2 cycles ago, 6 jobs, and this most recent cycle, 4 additional jobs. So we hadn't gotten jobs
No.
in years.
In clinical services, we
Employees,
have like
and
90
roles,
employees.
new roles to
Only
support
10 are
foundational
with
public
city.
health. So new employees, making sure that they are part of the fabric of public health. And as grants unfortunately term out, that's why we really don't like them. They're here for 3 years, 4 years, 5 years. We're very lucky they roll over on 5-year basis and staff get to stay. Like our WIC program, it's embedded into the fabric. They're not going anywhere. They've been here for decades, and they'll continue to be here.
Well, and I wanted to also make another point. Dr. Chamberlain talks about, the ability to have classrooms and auditorium and be that home. I know that the concern of many is that workforce development aspect. We were just designated as an academic public health department. You see the partnership that we have with University of Texas for dental services. That is something that has the potential to expand as well, is our partnerships with universities.
Which is part of the
So that we
presentation.
can also, sorry.
It's okay.
You're
Yeah,
taking
yeah.
away one of the slides.
Yes, and so
I'm just bringing it up for y'all.
we're gonna get
Thank you.
which is important, which we're gonna
Wait
get
till we're
there.
finished and then this way.
I read it mine now.
I'm waiting for the presentation to finish because I want, there's a ton of questions.
Yeah,
So
yeah,
I've got it.
Yeah.
So, of course, the focus on maternal, infant, and child health programs, the focus on chronic disease prevention and management programs, which of course will focus on developmental screenings and the disease prevention for vulnerable populations, substance use prevention, infectious disease prevention and control, enhance our disease surveillance, our education on infection prevention, our public health emergency response capacity, our environmental health and safety programs, which as mentioned is our high-level laboratories, such as our environmental, our BSL-2, our BSL-3. Not even the university has a BSL-3 lab, but public health does. Food safety. I just read in which one was it? In this needs assessment, which was published in in the first document that you had, that there was the one over there, the red one. I'm sorry, but you're fine. That in the 50s we had 4 sanitarians. So here in this one it says 4 sanitarians we had in 1954. Today, in 2024, we have 9, and those individuals are responsible for food safety. They can branch off into water, into soil, but they're specific to our food safety program. And they go around the restaurants and they're making sure they're all in top tier, they're providing them their scores, they're giving them the corrective feedback. But it was very interesting to see that in the 50s we had 4, and as of now, because we don't have any space either over there, we have 9, and we probably have quadrupled the number of food establishments, because I know in the last 10 years, we have doubled it, and we still sit at that. So, I mean, that is very telling alone on the food safety program and the investment that needs to be made into additional equipment that can be utilized for that program as well. Air and water quality monitoring, we just had an issue with water. With air, we know that's another issue because of our geographic location, but we do have good movement. I'm going to let you all know on the air quality, we have prevailing winds that come from the southeast to the north, southwest, from the southwest to the northeast that push out all the particulate matter. We do have occasional days where we are high, but we want to make sure that we are investing into that as well, and that is on.
Can you elaborate on that? I mean, is the air quality in Laredo is not?
The air quality in Laredo is good, and that can be proven at air.gov or airnow.gov, where they are demonstrating ozone and particulate matter on a daily basis. And the vast majority, I will say, out of 30 days, on a monthly basis, we have 23, 24 green days, and we'll have the rest that might be yellow, and very few far in between do we have an orange day, and we have not seen a day that is in the red. Which you do see that in areas like Houston, in San Antonio, in Dallas, in San Francisco, and all the metropolises.
Or during Carne Asadas.
Or during that is also, it's very true.
Really?
That is
Just
particulate matter.
starting the.
And that will kick up PM 2.5
Let's
and
keep it.
PM 10 monitors in the community.
Putting on.
Yes.
Keep on going into health education and community outreach for caregiver and family education, health education on neurodivergent individuals, lifestyle, specialized services, and research, investing in public health research labs for vulnerable population. We don't have a space for that, but we are very much prone. We're very proud of our public health staff who are also investing into their doctoral level, or not already achieved it. And so we have the talent here to run with research, and we have the capability as a public health accredited academic facility to turn that on. So we just don't have the space for it. And universities, of course, are say, for instance, UT in Austin or UNT in Dallas, they want to come in and have a space. Well, sorry, y'all, we can't. But this will help turn that on. Community engagement and cultural representation. I was also thinking that it would be really important, as this would to be designed out, that it incorporates the arts into the building, that is reflective of our culture, reflective of what's going on here, that it has sensory rooms and calming rooms, and that it's culturally provides that sensitive support. So in conclusion, there's that $60 million investment which will enable public health to meet current and future health needs, ensuring accessible, inclusive, and proactive services for generations to come. And that was the end.
So 60 million, I thought it wasn't 80 million?
There is 80 million on the table, and you all can make it 80 million if you choose. But we do have Miss Tina here who will present next. Miss Tina who will present at the next meeting her project, and so as collaborative colleagues, we made that decision as to how we would divvy the pot up. But it is ultimately your decision too. We would strongly ask you all to consider the macro level of public health and getting from the day somebody's born to as they are aging, because ultimately aging is what causes all the issues that we do have. And if we tackle that at a proactive level, at a root cause, that's public health's true job. Yes, preventing infection, because we promote, protect, but we prevent. We are at the proactive era of public health here, which is where we want to stay, instead of continuously being reactive to hearing about our 18% prevalence rate of diabetes in the community, when at the nationwide level it is 9. We are double. Our obesity rates are at 45%. Our inactivity rates, 1 out of every 4 persons in the community exercises. We need to do more, and we can do that through the public health infrastructure by investing into it, which ultimately increases vitality for everybody, because we do wanna grow old, but we wanna be
Healthy.
healthy. Mhm.
If I can say just a couple of words, that we're finished.
Yes, sir, we
and,
are.
And Chairman, you were at this meeting, the roundtable meeting, I'm the, at least last year, and I think this year I'm gonna be the chairman of the Alzheimer's Walk. Relating to Alzheimer's, and you were at the roundtable when Senator Saffirini was there, Dr. Chaudhry, Doritos, right now in dire need of help. And I get very emotional because I've had this in my family. But there's no treatment, right? There's none whatsoever. I'm working on getting the Leqembi, which will stabilize at least people from getting
Progressing.
worse. And I've talked to Mr. Leal and I've talked to Mr. Wilson. They're ready to go. It's just a matter of getting prescriptions. We don't really have a neurologist. I guess we have neurologists at each hospital. You've got Dr. Camero, I think, at LMC, and Dr. Jamil at Doctor's Hospital. Leqembi is available, and it looks like it's gonna be coming. There's some snags along the way. I think Doctor's Hospital, they said that they're ready. It's a matter of getting a prescription. We have a doctor that comes in from San Antonio twice a month, and that's not enough, but he didn't have anywhere to send them. They have to go to San Antonio to get treatment. If we can get, at least a start, is get the treatment here, which is Leqembi. There's another one called Bisondalis that was just approved in July, hasn't really gotten that far yet, but I'm hoping we can get that in the very near future. Laredo's #1 in Alzheimer's cases. It's not gonna get any better, it's gonna continue to get worse. And unless we treat the people now, I think we're gonna head into a bad situation. Aging, you brought it up, aging is something that,
Unfortunately, we don't like to think of it, but aging is actually a disease, and we need to treat that disease throughout life. And symptoms of that aging disease are Alzheimer's, dementia.
and something that we don't like to hear is, we're #1 in Alzheimer's cases. Hispanics have a 1.5 higher chance of getting Alzheimer's than an Anglo, and African Americans twice as much. Now, since we're a highly Hispanic market, that's why I think we have such high incidence. But unless we do research and find out, is it health, is it mental health, environmental factors, what is causing this issue here?
And so I appreciate you sharing that. I wanna say, as public health, that's what we do. We listen to the community and we demonstrate that we are understanding by applying out for these awards. So we just obtained this award that was pushed out at this last council, approved for the funding to kick in. And so Laredo will have an Alzheimer's needs assessment, also just overall collecting data that is non-existent right now.
It's non-existent.
So we will have that for the community moving forward. And that's what I'm trying to demonstrate here is that, okay, we're gonna have the data now, right? And we can apply for now other awards with NIH for research and bring it in. We just don't have the space that we can dedicate to these
And
public health challenges.
that's really because if we don't move now, I mean, I think Senator Saffirini says, we don't need it tomorrow, we need it yesterday.
Yep.
2 or 3 years is a long time to wait, especially with the rate of Alzheimer's cases that we're getting. I mean, it's sad to hear when someone can't afford a caretaker, when you go and lock someone in
Yes, sir.
and leave food. I mean, it's sad.
It's difficult.
But, there is people that can afford it, but the ones that can't. And there again, the Leqembi, that's another thing, is what percent is Medicare gonna pay for the treatment? And Leqembi is once every 2 weeks for ever until they find it. And Kasana's once a month, but that's a very new drug. That's for 18 months, and after 18 months, I think they goes to once a year. So it's a more tolerable type of treatment, but this is something that is very, very, it's gonna turn into a tsunami if we don't start taking care of it soon. And like I said, I did talk to, Mr. Leal, I talked to Mr. Wilson, and they said, Mr. Wilson said that we're ready. I'm just waiting, I don't like to say this, but my wife has it, and, I can go to San Antonio, I can afford it. I mean, to me, it's just a matter of getting it here, and I've had help from the doctors. Dr. Lolima's help at Doctor's Hospital. And if we can start getting people to get infusions, and there's enough cases to have not only doctors, they have an infusion centers, and LMC has an infusion center. And I'm not sure if Gateway has infusion centers, but it's a matter of stabilizing it, because if we don't get it early, after you get past the early stage, like cancer, it's too late. So it's very important, it's imperative that we start looking at that. And, you know, the initial part is the infusion, but they have to go through a cognitive test. The cognitive test tells them, and there's where the research comes in, is you take the cognitive test this year, and you start getting the infusion. How does it look the next year? How does it look the third year? Or after 6 months, is a person getting better or worse? So,
I appreciate you sharing your personal story. Thank you for being so open with us, and also for thinking about the individuals who don't have the accessibility to treatment or access, and you championing that, and count on public health to stand shoulder to shoulder with you and bring in those resources and be as loud as possible. Appreciate that.
Yeah, I mean, I'll chime in there. I think some of the items that have been kind of pointed out with regard to Alzheimer's is very eye-opening to see how much Laredo's being impacted. It's sort of this silent killer that we haven't been talking about.
it's
right?
a death it's terminal.
Yeah, but there's, you know, alongside that is also the diabetes rate here in Laredo. The number of, there's a ton of points that you hit, so I'll try to just, one, specialist. We don't have enough specialists, right? We don't have any, the specialties here, it just goes back to the numbers and the research. We are medically underserved in this community. So that's, I think, the challenge, not just for us, public health, but also Doctor's Hospital, Laredo, LMC. It's the challenge right now. How do we get these folks to come, set up shop, and live in our community? So it's sort of this bigger picture. When you start to look at it, it's like, well, it goes back to culture, and well, what is the culture right now, right? We just talked about carne asadas and all of that, but then you start thinking, well, why do only 1 in 4 people exercise here in Laredo? Well, 1 in 4 people only exercise here in Laredo. Well, then that goes back to health and our overall well-being. And then when the research right now, early research is showing that inactivity is could be one of the causes of Alzheimer's. So if we go back to Dr. Chamberlain's point, is if we can get people to be active, eat better, live a healthier lifestyle, that's, I think, where we're now being proactive instead of reactive, right? We're showing folks that, you know, this healthy lifestyle has a ton of benefits and can prevent you from getting some of these diseases. I don't know, right? Because the research is, we still don't know, right? At the end, though, I think in terms of what we have at the moment, starting with public health and supporting them in growth and research, I think going back to this bond, I think there's that need, right? And I support the presentation that you just made, because I think that's a step forward, right? That's gonna assist in
The macro
addressing
level.
at the macro level, where we can see some results. We can see these grant monies be put to use to try to find some answers and address some of those issues that you're bringing up. I had a ton of questions with regard, going back to the square footage and the cost, and I know Hector did too, because he was wondering, well, how are we getting to $1,000 per square foot? That's kind of, that's a really high number for construction.
Mhm.
If you're saying 3 years, you're taking that $900 into account for the 3 years, or is it gonna be more?
That's at like today's market. So I spoke with the chief engineer, Ramon Chavez, and he's the one who had given me the number, of course, from the 240 at the veterinary clinic to the 540, the fire department that is being built right now, or that is already gonna be underway, the expansion, if I'm not mistaken.
And it's a fleet building,
it's
so
a-
it's not a full, that price is not even for a full fire station with all the bells and whistles. This is the price that just got quoted about 2 weeks ago, 3 weeks ago.
$720 a
A
square
square
foot.
foot for just basically a warehouse.
And who is building this company?
Yeah.
Is this
Yes.
a local company?
I'm not sure.
So
who
we
the-
go, the city goes out for
Is it
bids, and the
sensitive?
problem is that the cost of materials and the cost of
Oh,
a
I-
lot
But
of
it's
things
not
that.
that
It's not that,
expensive,
no.
it's not
I'll-
that
I'll do
expensive.
some research.
I
on that.
agree with you.
Yes.
No,
I mean,
that's the market.
I
So
mean,
again,
they're
there's also,
happening.
that's the market that is out there. That is the costs that are coming in for.
I'll get- you wanna build this?
I mean, I'll build it for $1,000 a square foot.
It is my understanding, I believe, we're not getting enough.
Yeah,
But you
no,
know-
I'm in commercial real estate, guys, and
Yes.
there's just no way that,
Yeah.
but
But,
anyway.
but if
that's-
you
that's a-
factor,
that's a
if you
different story,
factor
yeah.
in
Maybe
the
$400 or
$1,000,
$500, so would be appropriate.
Is that
I
included?
originally had it at $500, and after the discussion with the chief engineer, I had
Is
to,
it just for the 4 walls, or does that also include the equipment that's
Right.
required?
it's for the 4 walls.
Oh my
so
God.
it
Yeah, it's
doesn't
so
include the
expensive.
equipment.
Well, and we do have to think about specialization, if we do need any upgrades to our laboratory. There is that consideration for our TB clinic, there's, the negative air pressure.
Well,
that
that's
needs to be-
included into the cost of the
Right,
$900.
so that's
Because
why-
negative air pressure for the TB area that's why it's at $900. Because there's, as Erica's mentioning, there's specifics in the healthcare realm that are not gonna happen at the animal care
Like
veterinary
X-ray.
facility.
But it's not, the whole building is gonna, that requirement,
No,
only certain rooms.
correct.
So I think it's just it's inflated
Mhm.
too much.
With regard to,
And
okay,
unfortunately, I'm so sorry to interrupt, and unfortunately, we couldn't tell you how much it would cost until we actually go out for
For bids.
qualifications, RFQs.
let's just say, we build this building at $600 a square foot. But we proposed 1,000 square foot. What happens to the extra money that
Yeah.
comes out of the
Mr. Mata,
bond?
that's a great question.
What do you mean,
So,
what's
so,
the extra money?
so he's
So-
saying that
We
we're,
put 1,000
let's
and we
say
only spent 600.
we spend it, we propose 1,000, but we only spend 600.
per square
Per
foot.
square
Instead of the 60 million, 40 million
So
was spent.
40
what
million,
happens
so
to
there's
the-
20 million left over.
Right, so when we go out and sell the bonds, you're gonna have already the items that are gonna be destined for that, and it has to be spent specifically, so they're not gonna touch it, it's gonna be reserved specifically for that.
And I guess if we go back one step before that, is right now what we're doing is we're getting the voters' approval to issue a bond. So if we issue a 60 million, or if we decided that we are gonna recommend an $80 million, once we move along the process and we find out what the actual cost of that building is as we go into the requests, then that's what we're gonna go sell that bond for. So we might have the authority, the voters' permission to do 80 million, but we might need 75, and we issue a 75 million
Correct.
bond issuance at that point.
What happens if the voters only approved 70 million and we need 90 million?
Then you need to come back,
You need to go back
you
to
need
the
to go back to
And
the
the voters have
yes.
to vote on
That's
it.
the-
Exactly. Either that, or we try to find another
So then-
financing mechanism.
So then shouldn't we already have those numbers accurately presented to the voters? Because that would, I almost feel like currently, a statement was made at the last meeting that people just don't trust government.
Mhm.
They do not trust the city government, and it came from former Councilman Vela,
Mhm.
who's been he's super vocal, but he made a ton of sense right now. Right now, you have the public perception right now that, again, he brought up the water situation, he brought up the salaries, and while this may not be directly related to it, people associate it with it. Perception is reality, right? So if we were to present folks with an $80 or $60 million ask, I think it would be counterintuitive if we came back to them, a year later asking for more money, right? And so don't we have some kind of
Well, and that's
concrete?
part of this exercise, and hence why the dialogue with the various departments presenting their needs. Certainly that comprehensive analysis of the costs need to be there, that estimate. But again, what the costs are right now, you have to consider that percentage increase in the future.
The overruns.
Exactly 2 years ago.
Mhm.
The overruns. That's the thing, that's what happens, you 60 million, but it turns out to be 70.
Correct.
Right, and it would just, I think it would shoot public health in the foot if we underfunded them when they really need more.
So in
right?
essence, you have to consider, he's giving you the price up to date. You have to consider, when is it actually gonna break ground? In 3 years, in 4 years? That's the that's the number that you have to
You
look
have to
for.
know the architectural work.
And then that's what I was thinking too, that perhaps in the numbers that, you know, we're listening to, and we're hearing about, the money, right, and that's what I'm referring to, the numbers, is that we, or you, each department, is considering the inflationary cost, because you're not gonna use all that money at the first year.
Mhm.
And so, you know, our construction cost, if it's X today, next year it's gonna be Y, and the third year it's gonna be Z. So, are there, you know, are those considerations being made?
So consideration has been made because of that extra 15,000 square foot building that we're asking to be built on this part of the property, that would be dropped
Yeah.
if needed.
Right, but what I mean
Mhm.
is if you guys are telling us that today's cost to
Mhm.
build that building is $900, it's not gonna be $900 in 2 years.
Mhm.
And then those monies, you know, for the bond referendum have to be used in a certain amount of time, you know, you're not gonna have the money.
Well,
years,
I
5
guess
years,
whoever
So you're
bids it,
asking, you're asking on, what was the total what's the total ask just for this particular project?
60 million.
60 million. But if it's 1,000 square feet, we're adding 73,000 square feet to it.
It's 79,000 and we're jumping up to 115. I mean 145.
What's the total addition? I'm sorry?
So it'll be 80 to 145, 45,000 square feet.
So 80, so we
Sorry.
really
No,
need
no, no, no.
65,000 square feet.
65,000.
65,000 square feet, so
So
$65 million is the ask
60 million
from you.
divided by 80.
Well, at $900 it's
65.
There's $900.
Well, while we're at it, let's just add another 5 million, so 65.
so it would be
65
65
million.
million at $1,000.
Now, so a lot of times you can get a contractor to give you a maximum, guaranteed maximum price, which
Mhm.
is,
And hold it,
and hold it,
Yeah,
they hold
hold
it
it.
that way.
yes.
And that's been done with the schools, I think, it's been done at Mr. Leindecker, Gary Leindecker from Leindecker Construction, they have the guaranteed maximum price for the schools, and they had to build it at that price. I'm sure they put a certain amount of overrun, so there's a guarantee.
You also don't want them, if they can build it for 50 million, but they say, oh, well, there's 60 available, let's spend them all.
Of course.
You
Now,
know, that's what it is.
now that's option one.
Mhm.
You said option two was to move.
To move and find a new
That's
location.
gonna be even more expensive.
That's
Yes.
that's why we went
What's-
option one first. So
What's the second option look like?
So option two is to find a vacant piece of land, which of course is
Mercy
the
Hospital.
So if you were to look at Mercy Hospital, that would require a structural assessment as well. That would be my recommendation because we don't know how good the bones are of that
Asbestos.
of that
Yes,
building.
I think that would be
Just
just.
getting the asbestos out is good.
Is the location nice? Absolutely. I mean, because we are still staying part of this neighborhood, as public health should be injected to make sure that we are accomplishing health equity in action. But there's so many unknowns about that building. I mean, the space would be nice. I looked it up. It's 242,000 square feet. That's almost triple what we would have right now, and can be done. A multitude of different other services and even businesses could be part of that infrastructure, but I don't even know if a number that was thrown out to talk to the economic development director is $10 million for the property,
Just to clean, and then
and
to clean
and
it.
then to bring it up to standard. I don't think even if you were to fund it at the full 80, right? You know, leaving Miss Tina out, which we don't want to do. I don't believe $80 million would be enough to renovate that building.
I don't think so.
10 million, what about to demolish it?
I'm not.
Oh,
Well,
yeah,
you
that would be
first
a
you have
lot.
to clean, you have to get the asbestos out, that's gonna cost you
Yeah,
5 to
yeah,
10
yeah.
million, just to get that out, easily, if not more. The asbestos in that building was built in the
No,
old.
I'm saying to demolish it completely.
Yeah,
You
you
still
have,
have
you
to
still,
lower
you
it.
still
You
have
still
to,
have to
you still
remove
have,
the
you still have
Oh,
to,
yes.
yeah, you remove the asbestos because when you
First.
demolish
Do
it,
remediation.
Yeah, we'll go to the-
Wow.
Yeah,
Yeah.
You know that.
And then the demolition is also gonna be expensive, cause it's,
and then we go back to the $1,000 a square
And then
foot
to
to build
rebuild.
up.
They still remodel.
yeah,
The budget director is saying to remodel here.
I think so, that, I
Let me
think that
ask,
would be a best option.
Would, let's say the building was donated,
It would still go back to the structural assessment.
With or without remediation?
without remediation, but let's say the building was donated.
What building?
Mercy Hospital.
siento carácter.
They're not gonna donate it. I mean, you gotta
I
be
know.
realistic, it's not gonna
Well,
happen.
even if it was donated, we still need to do a study
Yes.
of the hazards. Because I don't think it's just the asbestos, there's subterranean, issues as well. So. there
That's
has
up
to
for
be an
discussion at
assessment.
this upcoming council meeting also, so we can actually provide a report to you all. Is that there is an item by the mayor to discuss that on Monday night,
Discuss what, the Mercy?
the Mercy Hospital. Not for public health, but just what's the status of that building?
I thought they were, yeah, I thought they were gonna get rid of that a long time ago.
I
Well,
mean,
the
really,
use-
I think, you know, in talking to the owners, they're gonna make their presentation on that, so it'll be interesting to see what,
So you're asking us to consider the 60 million, don't worry about the number right now, just to see if we wanna go forward with that?
To,
and-
to
and
invest
then-
into the
And
public
then
health,
do it include Tina.
and to include Tina, yes.
And now, in Tina's presentation, you know,
well,
so
For this
real
today.
quick, can I be recognized so I can?
Yes.
I can
Yeah,
speak?
go ahead.
Okay. So, the presentation we talked about today is just basically our public health facilities, right?
Correct.
We still have to talk about the Hamilton Hotel improvement, and that's
That
gonna
would
be
be
Tina.
Tina's.
That's Tina.
And then the third, item is gonna be the unfunded liability.
We are getting clarification if that can be included on the bond referendum as that sides on operational costs.
Right.
So Mr. Juarez is gonna provide us that statement, that's a question that I asked, I also know that Mr. Mata asked him as well, so we're waiting for that response. But if indeed, so that would, Ms. Tina, I'll throw out a number, you know, I might be stepping ahead, is looking at 8 million.
Right.
60 million, so 68, so there's still 12 available if the unfunded liabilities cannot be included into this.
Understood, okay. So then my other question, we tabled the topic regarding the pediatric hospital.
Correct.
And so this numbers, by the way, that we're looking on in our guidelines, you know, basically are just numbers. And they
Correct,
total
yes,
$844 million. From my understanding, most, if not all, you know, this bonds are gonna be done separately, they're not gonna be done together, okay? So each bond referendum is gonna have, each one is gonna, you know, we're gonna have to do a very good job of selling this to the community.
Mhm.
The community may choose to vote for one and vote against another,
Mhm.
okay, so that's important. But having said that, with this $60 million proposal for this, you know, facility alone, what happens with the pediatric hospital?
well, from what my understanding is, we all have to vote on this to then take it to the bond committee,
Right.
and then the bond committee will then vote after we present to them.
Right.
So you
whether
can
we're gonna
have both of the presentations.
Right,
Okay, very well. And then the other thing I wanna mention, and maybe you can give us some clarification, Mr. Mata, is all of us that are participating in the subcommittees, we're basically representing our community. And we're listening to each department, right? Public safety is already, you know, heard from PD, fire. And, we're basically, you know, doing the presentations to the main committee for the bond referendum. But ours is just a recommendation to city council.
Mhm.
City council can go in there and says, you know what,
None of it.
Yes.
we're gonna just basically do
Whatever they
something
want.
completely different, okay.
Yeah.
I just wanna make sure everybody
So,
understands.
so it would be, the subcommittee and the committee is to get a solid, list, prioritized, you know, dress, you know, by year, of the needs. and sell that, one to the main committee, so that they can come contest to the final list that's gonna be presented to council. And even at that point, council is gonna have their.
Yeah.
And that's true.
Can do their
And
own.
so on that note, we have to be realistic. We can't just come up with a wish list and put, you know,
Correct.
we can't do a wish list for Christmas and this is everything that I want, Santa. And, you know, we know that when Santa comes, we might get 2 of the 10 things we ask for.
Right.
So we have to be very realistic on what we're gonna be asking for, to be able to do a good sell to city council, and then hopefully they will listen to, you know, what we're asking for and move on it.
From the public health perspective, when we can impact many lives, that's where we win.
Exactly.
From the healthcare perspective,
Right.
absolutely we need the pediatric-ists, intensivists, specialists, but that is, for a small population, that is in need of those services versus when we can be visionary and proactive to better life in Laredo.
And then you start from the beginning, right? You don't start from the specialty hospital, you start from a clinic.
Yeah.
And then you build on top of it.
People's lives are at matter here, I mean,
I
we're really
guess the
talking.
conversation to have, to the point is, earlier, is how can we facilitate the, you know, having access to those, hospitals, those, pediatric hospitals? You know, how as a community can we facilitate that?
And that can come through discussions with city leaders, organizational leaders coming to the table and asking for that support from these private organizations, and even the state government, for them to get involved, and make these requests with us, because that's how ultimately we make changes, through our collective voices.
On that note too, in specifically regarding the improvements of the public health facility, we have to keep in mind that who votes? You know, who's gonna be voting on this referendum, right? And if we're realistic about that, most of the people that need the public health service probably not gonna be voting. The people that are insured, the people that, you know, have insurance, go to the hospitals, to the other hospitals, whether it's Gateway, Laredo Medical Center, and Doctors Hospital, are probably gonna be more the ones that are voting, right? So we need to make sure that the people that we are going to, the people that are gonna, you know, go vote, we need to make sure that we do a good job of educating them what specific needs they're gonna be voting for. Because they may say, why am I gonna, you know, vote on a referendum to provide $60 million to improve the public health building? You know, I don't use it. And so we have to make sure that they understand why there is a specific need for them to be able to vote yes, as opposed to voting no.
Yes.
Because that's what happens with a lot of things, like the convention center. And does Laredo need a convention center? I can tell you, you know, that most of us in this office are gonna say yes, because we understand, we come from the business sector. But most people say, we need a convention center, we don't. So part of it has to do with the education. We have to make sure we really educate our community to make sure that the bond referendums, you know.
And part of the campaign will be just exactly doing that, is getting out there. We're very fortunate in this moment of time too, that Laredo Public Health has a public health promotion team, or AKA a cheerleader team, that is out there outside of the HEBs, Walmarts, Dr. Ike's, making sure that people are aware of the services we have, but we'll pivot to educating them on the importance of voting for this, should this be approved by this group, approved by the bond council overall, and then put to the council as a whole.
And it has to be a very simple message, like you said, like, we're gonna build a clinic, we're gonna build a laboratory, even though we have a small one, that is gonna be the selling
enhancement.
point, yes.
Yeah.
Because a lot of people, I'm
Go
sorry.
ahead, Joe.
No, a lot of people don't even know where this building is.
Except for the
I
people that
guess-
use it.
Yes,
Oh,
the only time you come to this building is to get a copy of the death certificate or a copy of your birth certificate.
In
No?
caveat to that, does the public health department, accept the private insurance.
Yes.
Yes.
No, we don't.
You don't?
Now we
do or
do.
no?
Yes.
Now
In
we
the
do,
past,
yes, in the
we-
past,
So
no,
has
but now we
that
do.
been promoted?
Yes, so it
Yes.
started with our
What is the
vaccines.
comparable to the,
Mhm.
to the public
Mhm.
competition, to the private competition? And so I think that needs to be also
Part of the package.
part of it.
Yeah, absolutely. And that's why we have switched ours.
That
Our
this
slogan
is
is
an
that
option.
public health is for all, and public health has no borders because of our geographic location.
Mm-hmm.
So this facility is for every single person, and we saw during COVID, regardless of your socioeconomic background or your status or what your literacy level, everybody was getting vaccinated here.
Yes.
So people know now where public health is, because we vaccinated more than 333,000 persons, which is also very telling because our census tells us we're at 254, but we did 333,000, and those were unique individuals.
Yes, and for specific clinics like the Alzheimer, we want to take private insurance so that we are cost efficient somehow with the uninsured population. So, and that we can do.
I think that's where the sub
Yes.
needs to happen.
Mhm.
And push that
Yeah.
agenda.
Yeah, that goes back to, again, that was another, it's a great point, Hector. It's just there's gotta be a major campaign, marketing campaign, right? Me as a marketing professional, from when we tried to go out to pitch the convention center and it failed, and seeing how campaigns work and this, and trying to convince people, hey, gotta raise your property taxes because you're gonna pay for this, you know, and then misinformation gets out there. There's a ton of stuff that can go wrong with this. So yeah, that's my only note on that. Because for time purposes, because I wanna make sure that we get to everything else. Unless you all have any other,
I do have a couple of questions.
go ahead.
How, in specifically to the public health facility, how many people utilize this facility?
So as Dr. Sada just mentioned a few short moments ago, just on the encounters on the clinical side,
30,000.
30,000.
30,000.
But then of course we have thousands of persons that come to get their birth certificates, their death certificates, to get their license for their food establishments,
Right.
to visit
Which
with.
is a different type of service, right?
Mhm. We have more than 45 different programs and services that are run here.
And then I think we had, the other question I had regarding insurance. So now you all accept insurance, and that's again has to be part of the education campaign,
Mhm.
because a lot of people don't know that. The monies that you talked about, the grants that you said that you've already, you received about 10 grants for $10 million and possibly maybe getting another one for 20 million.
Mhm.
So we're talking about $30 million. Have you all taken those monies into consideration,
For
in
program-
addition to the 60
For
million?
program expansion,
That would
any
be
federal.
So that is
any
totally for separate
federal-
different.
For
federal or state-
operational,
That is
Federal and
operational.
state awards do not allow you to spend on brick and mortar.
Brick and mortar.
Awesome.
But we don't
That's
have
right,
only
that we
20, we have
have,
like 60
Correct.
grants. How
That
many
you
grants
all
we
are
have?
working
Yes.
on, yeah. But
No,
so
that
far
we
you've got
already
them.
have.
But those
No, we
are
have-
strictly
Yeah.
operational.
Yes, operational.
They don't
Strictly
allow you to
operational.
invest into
Okay.
any brick and mortar.
Okay, good.
How many grants do you manage?
I mean, we for sure it's more than 42 different programs, so for more than 42 different
Yes.
grants.
That we are
Mhm.
well, currently have.
Mhm.
Perfect. Okay, that's it.
Which contributes to our $32 million budget at the city of Laredo, which is 71% grant funded.
And the city of Laredo has two doctors, a daughter of a doctor, and a wife of a doctor. You would think that they would.
They are being very supportive of us right now.
Yeah, but we contract like 8 more doctors. We Dr. Wilder Vasquez.
Oh, what are you talking about?
Yeah, no, I'm talking council,
Yeah.
city
Oh,
council.
city council, I'm
City
sorry.
council,
Yeah.
we've got 4 council members there that are either a
Health
doctor
forward.
or
Health forward.
a doctor.
Health forward.
Yeah.
And I want to say something. This is based on conversation I've heard. They are not very buying into funding clinics because they always said what is doing Webb County for the public health. And like I said, I don't know what they're doing, but the patients are here. That's a need that we have.
Exactly.
Let them do whatever they want. The city has to do
The
the.
majority of the people are in Laredo.
City of
Yeah,
Laredo.
that kind of goes back though to, again, public outreach,
Yes.
education, about what really happens between these walls, cause a lot of people know about it, but they don't really understand until they actually walk through these doors and understand what's happening in here, 'cause there's a lot of great work, so that might be just, again, going back to that outreach comment that I made earlier. Do you all have any other additional items, cause I'd like to.
Well, just one more, can you, all the people that come and visit here, if it does pass city council and it goes for a vote, would you all be able to promote it here from the people that come here?
No.
Or is that's, you can't do it?
Yeah, once it gets put before the people,
You can't talk.
you
can't-
can't engage in.
So we can't
Citywide,
we
we
can't
can publish
educate,
it,
yeah,
but
but we,
you
locally.
can't
Can't
share.
push 'em.
You can't push it.
Well, not push it, just
staff-
recommend.
The staff is not allowed to do it.
So.
We can tell them now, though.
Yeah.
We can tell now.
Oh, well, that's a great point. Okay, so let's say we take it to the voters, whatever happens with these bonds, or with this bond. Let's say we take it to the voters, how is the marketing?
There is going to
The
be outreach,
promotion.
if you see on your,
It's in the.
you have a
Okay.
PIO.
But PIO,
will take the lead on that one. They will help, promote this.
okay.
What about, like, we can't control if partners decide,
No,
like
you
a
can't- you can't.
nonprofit
You can't.
decides to publicly express their support towards a proposition.
Right. I mean,
Gotcha.
it's just,
But that would need to be funded, through an outside entity and private. Okay, gotcha.
but there is going to be, as the entire, there is going to be promoted, it is going to be.
There will, yeah.
Well,
The
yeah.
city will
There's
promote it.
certain guidelines that they have to follow.
Yeah, no, I
Specific
get that part, but there's, if you don't have the right, and again, it's not a dig at PIO or anything, but if you don't have the right messaging and you don't have the right folks that understand how to move something like this,
Right,
it's
and again,
gonna hit a brick wall.
as a committee, you cannot engage.
Right,
You can certainly, this is an open, this is open to the public, it's a public meeting. So anyone can come, anyone can take notes, anyone can advocate.
sure.
You folks can't, if that makes sense.
No, got it.
So this is an open meeting, someone can come to this meeting.
Yes.
Oh, yeah.
It's a public meeting.
Yeah, no, I think, I'm just speaking about when we let the folks know, what is it, 45 days? It's a 45-day notice, what's the notice on letting folks know it's gonna go to the ballots,
Nah,
to the ballot box?
I read it.
it's in there.
Yeah, I don't know, if it's a 45-day notice or something that before it goes to the voter,
Yes,
It's in the
20 days or later than 45 days after the date.
Yeah.
Runoff date.
so it's a,
Election. Says election shall be ordered no later than 78 days before the election.
so you have 2 months to educate people on why they should say yes to increasing the property taxes.
That's basically what it is.
Yeah. So that's gonna be the mission right there after that. Because I feel like all the requests and the asks are there, it's just convincing,
Passing it.
John Q. Public to say yes. But with that, so then the ask, Dr. Chamberlain, one more time, is $65 million, $60 million from public health,
$60 million.
60 million.
You know what?
8 million.
8 million,
See that?
She had to step out.
okay,
But she'll be presenting
She'll
at the
be
next
presenting on
meeting.
Tuesday.
okay,
So that leaves 12.
do we want to table, well, first, hold on, let's get through public health really quickly. So $60 million is the ask, I'm gonna entertain a motion, to accept the $60 million ask for public health, as part of our public health and wellness, subcommittee. Proposal.
A motion of 60
So-
million seconds.
Okay. Motion, Jorge?
Second.
Javier,
Motion by second.
Javier first,
By second.
okay. All those in favor?
Well, you gotta have discussion.
Discussion.
Discussion?
Yeah.
So I have discussion, so, I think that we need to do a very good job of, you know, we're gonna be presenting to the bond referendum committee, okay, at the city chamber. Let's make sure we have all the information, the breakdown of what's gonna make up the $60 million. Because, it's important to show how much money is gonna be spent, facilities, et cetera, everything just kinda broken down, otherwise, you know, it'll be a challenge, even for city council when it goes up to them, because if we can kinda break it down, it gives us an opportunity to maybe get some of the things approved, and maybe we may not get everything, right? But at least we'll get some of it, as opposed to, well, it's gonna be $60 million for everything. If we don't provide a good breakdown of all of that, then we may lose everything. You follow me?
It's also important you address your M&O.
Mm-hmm.
Your M&O and the sourcing.
That will probably be asked, so it's a great point, Hector. How much of an impact will this have on the general fund? Once constructed,
Mm-hmm.
you know, staffing,
Well, 71% is grant funded.
Mm-hmm.
but will there be an impact to the fund from your
Potentially.
2.3% of the general fund right
Potentially
now?
utilities.
Electricity and water.
Yeah.
What about staffing?
Staffing's already here.
Staffing's already here.
We're just gonna
So
move to
the staffing's gonna stay the same, it's just gonna.
We're gonna grow
You
with
might
grants
have-
coming in and new staff.
Additional
coming in.
staffing is gonna be
So
supported
that'd be
through grants.
through grants.
I guess the question would be if
Mm, state,
the staffing is, you might need more custodians, we might have
Right.
a higher insurance bill now that we have a bigger building,
Yeah,
higher
insurance.
utilities,
Mhm.
electricity, I think that's a component that we need to
Mhm.
consider for the
Right.
maintenance and operations that's gonna be impacting the general fund.
Right.
I can assure you those questions are gonna be asked.
Would-
I'm writing all this down now, I promise, this is
Yeah,
where I'm doing
you know,
it.
and I can guarantee it'll come, it's not gonna come from, it might come from me, but it might not come from David, but it'll probably come from the other two chairs, from the other subcommittees, and from the public.
And if I may share, part of the other discussions that I've heard in the other committees as well as the committee that we had, the main one, is that when we implement this cost, which is the building is gonna be paid by this additional money that's gonna be taxed to pay the debt service. But the M&O component may also trigger a necessity to increase the tax rate on the M&O. Because there's so much we can absorb from one year to the next year from property taxes and sales taxes, which are our two main revenue sources. So in order to get some of these projects done, we might have to consider also an M&O impact as well. So if we were to get, for example, 10 cents for the different debt service payment, we might need another 3 or 4 or 5 cents on the M&O side. If we wanna expedite some of these items because our growth is not growing, the revenue sources are not growing as fast as our expenditures are growing. So those are thoughts that might be coming down the road, and somebody might be asking us, well, you're gonna build this building, and what is the impact of the M&O, and do we have that capacity to put up in
This same
invest?
M&O topic is for fire, for police.
Exactly,
so,
yes.
yeah.
Yes,
And if I could
That's not
provide
just
another
public health.
angle to that, with the expanding of public health capacity, knowing that now we are able to capture private insurance and be public health for all, as we've always have been, we have been exploring, I mean, just in the last, 2 years, we've incorporated some additional revenue sources on the medical side, so.
Very, very good point, yeah, I'd recommend that information also be included in the report.
We're all gonna be there at the. So
So
we're gonna throw in our.
one of the things is also to talk about growth and need, and I thought that was very effective from police and fire, is to really highlight how much growth is anticipated for the next 5 to 7 years for public health, because that's also going to be why we need
To
so
expand,
much square
yes.
feet. So why do we need to expand our services? We're a growing city. I think everybody understands that, right? Everybody can feel it within the traffic wall, lanes here in Laredo. But it's really trying to get folks to understand, hey man, we're not little, health department anymore. We're public health now. Like we're.
Yes.
So those are important things, right? So I would definitely bring up the amount of encounters you expect to
Yes.
see in the next 5 to 7 years, what that growth has been in the past
Yes.
to now, and that's what I would say.
To that point, I think, the city manager, he was saying that we're growing exponentially a lot faster than most cities in Texas. We're going at 13.5, I don't remember the exact percent, 13.5% growth versus, everybody else's state was like at a 5 or 6%.
Mm.
So Laredo right now is booming. So that is a factor on making sure that there's gonna be the facility here to be able to accommodate all the extra growth.
Right.
We'll break down what you're asking
Yes.
for and also include, just as I mentioned at the beginning, we applied for 18 grants, we have gotten 7. If we keep at that rate, I mean, each grant has potentially anywhere between 2 to 5 staff, and that's on an annual basis, rolling 7 new grants, 7 new grants, 7 new grants. I mean, we're just adding up the different persons coming into the building on staff wise, but then also people coming into the building, because now that we have Alzheimer's support, more persons, even regardless of your socioeconomic background, are gonna be wanting to be part of it as well.
Yeah, I just think that you may not get asked those questions, but
But
if
just
you
be
do,
prepared.
you've got
Yeah, be
ammo
prepared.
to
Yeah.
answer these questions, right?
Thank you.
And going to the staffing point, I will reiterate again, we can't just consider potential FTEs with grants, but interns, volunteers, student,
The research workers.
we have upwards of also 40 programs with various educational institutions that come and
Already
do
here.
internships here, that we have
Caseworkers,
rotations
FNPs.
from high
Residencies.
school, from
Counselors,
support
yeah.
services with
Both
medical
residency
office
programs.
assistants to
How many FTEs
residency.
do you all have currently at the moment?
330. That's
Oh,
including
with
our
animal care, yes.
330. And do you have a number as to how many you'll need once you expand?
I mean, that number will never stop growing with all new programs and services that we bring in. So it'll continue to grow no matter what.
What is FTE, Rodney?
Full-time
Full-time
equivalent
equivalent.
positions, so those are positions funded by either the city or a grant. And that would require not only their base salary, but any fringe benefits that they're provided by the city.
FTEs are, what percentage of the 330 is covered by grants at the moment?
71%.
71%? Gotcha, okay.
Mr. Espasa doesn't like me saying that out loud.
No.
He always has the
He wants the
reaction.
truth to come out, and that is the truth.
Anyway,
It is what it is.
TQM.
It is what it is. So then, any other discussion? So then we revert back to the call for vote. Okay, we have a motion, second. All those in favor?
Aye.
Aye. Motion carries. Alright.
Why not?
We have a motion to adjourn.
We do have a little discussion really quick.
Real quick, so the public health department enhancements and improvements proposal, that's the Hamilton Hotel?
No, that was this.
That was this.
Yes, that was
Okay.
this. Hamilton
So-
Hotel will be next meeting.
Yeah, and just,
Hamilton Hotel will be next meeting?
Yes, on
you know,
Tuesday.
for the
Tuesday.
purpose of me, putting the minutes as the secretary, this is the motion that we just voted on. And it is to approve the $60 million presented by the Public Health Department for the Public Health Department enhancements and improvements proposal, period.
Period.
Not include the Hamilton or PD or anything
Which
else.
is mainly the building
So
itself.
PD was tabled for next meeting, depending on what our
Mhm.
response is from legal. Hamilton will be on the next presentation, or next meeting. Currently, we're on our next item, open discussion, any other items for discussion. We'll open it up.
I believe, Mr. Chairman, you had some open discussion as to meetings that you wanted to
Yes,
discuss.
so I did wanna discuss, if we could accelerate our meetings to try to see if we could get a little bit more done, so that way we could possibly
We
present.
can have to present by December tenth.
Possibly present by December 10th. If we were to spread them out, I don't think we're gonna get there, just given the amount of discussion that we just had today. So I'd like to try to see if we can, I'd like to try to propose another meeting, so,
Here you are up here, the calendar, you have the next one on the 19th, which is right
we,
here.
if we could, I'd like to try to shoot for another meeting on the 19th.
No, we
We
already,
already
we already
have
have
it.
it, it's already in the calendar.
Yes.
Sorry,
We
we've
do?
already approved that.
Mhm.
Yeah.
Mhm.
At noon?
Yes.
Yes.
Yes, from 12 to 2.
I won't be able to make that.
Yeah, I don't know, that'll be, we'll propose another time.
You all can definitely do that.
I'd
I'd
say we
like-
stick to that schedule, cause the only one that's set that you can't make it is Jorge. And I would
I may
imagine
not
that
be able to
Pancho.
make it either.
You may not be able to, well,
Yeah,
You don't know
because
for- you don't know
of,
for sure.
lost the quorum.
If
If there's 4 members, you can have the meeting.
Right.
But if he's in
it's already
Oh, the
losing,
chair.
we're already losing two and we lost.
I'm good, Lupita, you're good for next
I'm
Tuesday?
good for next
Yeah.
Tuesday.
Javier, you're good for
Let me
next
see,
Tuesday?
Tuesday,
In the afternoon?
well,
You
Tuesday's
do
the
that,
19th is, yeah, right, that's the original date,
Because
yes.
don't you need to
So
post it?
Jorge and
Mhm.
David, are you guys available at a different time on Tuesday?
I maybe, yes,
Because
I'm
if
just
that's the
double
case,
checking.
we can just change the time.
Yes,
The other
Or
groups have been
earlier.
meeting at 5:30, 6, so.
Yeah, I mean, we can leave it on Tuesday too.
I'm okay in the afternoons at 5, I mean, it's fine.
Okay.
Or in the mornings at 10.
Sorry, I'm doing,
I go to sleep at 8.
That is
And now
that
earlier,
is
so it gets darker
restorative
faster.
sleep. That is restorative sleep, so
Yes.
that's great.
That's
Yes.
Keep that up.
Preventative care.
Yeah.
yeah, no, you know what, actually Tuesday I am
I got up
good.
at 7.
Awesome.
There you go.
Lovely.
9 to 7, wow.
What
Was
your
that
body
the-
needs.
I'm
Your
counting on
body.
Tuesday.
And you're good at what, at 5?
No, no, but I'm the only one, so don't worry about it. I have
Okay.
a board meeting, so.
So keep it at 12.
Keep it up.
12 on Tuesday?
And then
And you can make it?
Anyway,
Yes, I thought it was
have a
gonna be in
conflict
Hamilton,
with Tina
but I'll
because
be-
I'm one of the owners of the Hamilton,
Oh, okay.
someone that,
Oh, so he would have,
Sit down.
so I have to abstain.
Not-
You'd have to,
not vote.
I have to abstain.
okay.
So then we do, because we have to publish the agenda today.
So the
So
19th is
we
good.
are okay for the
Do the
19th
19th.
at 12
19 at 12,
with the agenda item that has Tina's Hamilton Hotel.
right.
We are gonna add the unfunded liabilities, even if we'll get clarification if it can be discussed, if not, y'all will just say that item is tabled and it'll never be brought back. And then, just for open discussion, I will invite, both CEOs from the hospitals to be here present,
On Tuesday?
on Tuesday.
Okay, we have that one.
I'd like to
Uh,
include Elmo in that one too. if
Okay, well,
possible.
we have a board meeting.
So we just heard right now that we have a board meeting at LNC, so
Okay, yeah.
Booker won't be able to join
How
on
about,
Tuesday.
your CFO or your or your COO?
What's the meeting after that?
There's board meeting.
Well, on that
You know,
note, is it possible for them to at least, maybe send us some, written information regarding their thoughts on the question?
So what question would you all like?
It was the
Well,
pediatric.
Private, public.
Well, what a pediatric hospital would mean to them, I think more than anything.
What do they need from
Yeah, they can
pediatrics?
send us, put something up on,
What
What are your thoughts on supporting the pediatric hospital?
Pediatric
Put it to them that way.
hospital. Yeah.
And then I'd like to find out from them, what other options, if we can't have a pediatrics hospital in Nuevo, what other options are available for us to provide more care than what we're currently getting? And I think that is more doable than having this dream wish that we're gonna be building a pediatric hospital, because I was in the healthcare business for 12 years before I changed careers, over time. And, that's something that's been discussed for the last 20 years.
Yes.
And again, we have to be realistic, we're just not big enough, our population is
yeah,
and
we're
that's,
small.
it's the same thing as why we
150
don't
miles.
get the monies that we need for our infrastructure of roads in Laredo being the #1 port in the country. And the fact is that they have a formula that's based on population. And going back to a pediatric hospital, we just don't have
the need, the numbers, yeah.
We don't have the
The
numbers.
need we have,
So
we just don't
then,
have the numbers to support it.
Or
so,
the types of cases that require it, yeah.
so can I get a motion, for, we need to entertain a motion, right, for next meeting, or did we already vote on that?
No, it's
No,
already-
it's already-
it's already voted
What
on.
about for the agenda? Do we need a motion for that?
No.
No, we're good? Okay. So then the agenda will include Hamilton, unfunded liabilities, update from legal, private partner, word from the CEOs, anything else?
Good.
Yeah, cause you don't know if Andrew's gonna make it, Andrew.
We don't know.
Wilson.
But in writing, I feel like I'll be able to read
Yeah,
something.
right.
Yeah.
Right.
Mhm.
Exactly.
Mhm.
Okay.
I think they
And then
prefer
on
it
that-
to be called bond counsel.
Right. And on that day, we can discuss, what our
Legal.
next meeting would be.
Yeah.
Right.
Bond
counsel.
Bond counsel.
Because I think
Sorry.
we're pretty much,
Bond counsel.
we'll be pretty much done. I mean, we can kind of visit, after that on a different meeting. But, we'll be ready to do a presentation by December 10th.
So,
I'd love to.
should I
Get
put
it done.
that in the agenda for the December 10th?
Yes, sir.
That you guys will be ready for
Mhm.
this? Okay, well, I'll wait till next meeting.
Okay,
And
yeah.
just let me know.
If we
when
need,
they
we
send
could
what
just
the-
add one more meeting on ours.
Either that or add an extra hour, I mean, you can get
Yes.
from 12 to 3.
And again, folks, you are not limited to once a week. You can meet tomorrow if you please. So, as often as you want, the sooner
Got
that
posted.
you.
You got it posted today?
Yeah,
See.
you-
I thought I
Not
heard-
tomorrow,
I think I
sorry,
heard-
72 hours from now, we can.
72 hours, yes.
I
I
think
thought I
after
heard
next
the last
Tuesday,
time
we'll
we
decide if we
couldn't-
need to meet again.
The public safety has brought very good presentations, pretty solid presentations on their items. Again, just consider that, if you haven't had the opportunity to see that video, I would encourage you to.
Excuse me, who is gonna be doing the presentation, the chair or Dr. Chair?
Well, the chair will initiate the conversation but the presentation will come from the departments.
Okay.
But it'll be a collective collaboration.
Yeah. Dr. Chamberlain, I'm confident in your abilities to present.
He likes to talk.
Yeah.
Well,
I'm sure you'll present all 50 slides.
Yeah.
Yeah.
loves
doing
And more.
Yeah, by power.
And
More is
Tina, and Tina also, so I think we're gonna be good to go for that meeting. So with that, then we'll adjourn, the time,
Need a motion.
I need a motion to adjourn,
I move to.
okay?
Okay, and then,
And the time is 2:08. All those in favor?
All right.
Aye.
Aye.
Thank you very much.